I am Laurel Barr. I am here with the YPS section, trying to find out the best of ACEP and interview section leaders to find out what would be a best fit and who would like to join their sections or just what they're all about. So I'm here with Diana Savitzky. She is a pediatric emergency medicine physician. And Diana, could you tell us a little bit more about yourself and who you
Yeah,
represent?
absolutely. So I'm a PEM physician and I did a pediatric residency and then followed by a PEM fellowship. And that's how I found myself in the emergency medicine space. In addition to that, I'm also a wife and a mom to two young girls who are almost about 4 and 6. So I have my hands full. And I live in a suburb of New York City on Long Island, and I work in a pediatric ED within like a main ED.
So I'm guessing you have a lot of princesses in your life then.
Oh, yes, definitely.
It's never a young physician section without mentioning the children or the dogs or the
Yes.
whatever we do in our free time, which is absolutely perfect for this section.
Yeah.
So what section are you representing today?
I'm the chair of the ACEP Wellness Section, and I served as the chair-elect for the past 2 years since 2023, and I will have a 2-year term, which means that my term will end at the national meeting in 2026. But of course, I plan to stay in touch and work closely, and I'm also a member of the Wellbeing Committee, which does a lot of the good work that I get to promote as the Wellness Section chair.
Excellent. How did you get involved in this section?
Well, taking a step back and just sort of explaining like how did I get into this section at all is, to talk about my story. So it's probably a similar story to many people who find themselves in the wellness section. I've experienced burnout during my training. So in my case, it was during my PEM fellowship and sort of looking for a way out and, feeling like I'm desperately searching for a way to have a maintenance plan. I can try to stay in a good state. I kind of came to a place where I felt like, oh, if I just, adjusted my lifestyle, as best I could, like little things like looking at my schedule for the week, kind of planning it all out, budgeting my time and where I was gonna like push myself or not, with respect to a shift. If I did all that meal planning, I could have kind of like the best food, to fuel myself and scheduling exercise or, yoga, meditation right before I go to sleep to try to be as zen as possible, putting my phone away from my nightstand, drinking green juices, like all these things that you could do. I wanted to make myself the most resilient I could, to try to prevent burnout or just sort of, avoid that, and set myself up to have the best chance to be my best self. But it came to a point where I felt like it fell short. There's really only I could do that, and yet I still would be faced with enormous amount of stress, because of external factors around me that they're so great, like for the problem with so many patients boarding in the ED that I need to cultivate a practice. Like I have to actually figure out how to create a practice of waiting room medicine, and just like hearing about the news, it seems like you hear about news stories all the time about workplace violence, in a hospital, especially in an emergency department, like the most recent one, with a group of the ICU clinicians being held at a gunpoint. It gets to a point where you feel like, well, how am I going to drink green juice to get out of this? And so there's really not enough yoga classes to overcome it. And, personally, the reason I got involved with the section with ACEP is because I'm tired of waiting for everything to change, and I want to be part of the change. I want things to be better because of the work that I do.
Absolutely. I think with 63% of emergency physicians burned out right now, it can't just be not enough yoga or green juices. And congrats to you for trying all those things, because I took a different attitude and said I want to. I'm not sure that I want to even try those green juices. But
Yeah.
thank you so much for all the work you do. What are you working on? What is the focus of the wellness section right now?
Well, I think it's good to first talk about definitions, and say what I mean when I talk about our wellness section, because I think a lot of people may have, preconceived notion differences in definitions, and understandably, because I think that, as anything evolves, emergency medicine evolves, these sections have evolved. I think it's important to talk about, like, what are we talking about when we say wellness? So I do think a lot of people define or equate wellness with yoga and meditation. And it's not to say that it's not part of it, but I actually think that we're doing more. And so, our section is called the wellness section, but we're actually looking into a name change that would, say more appropriately define what we're doing. And so, I think a better term would be something more like professional well-being. We could call that the well-being section. And then the committee would probably follow suit, and they're actually pursuing the same kind of name change. That way we kind of are together, that our section and our committee kind of work hand in hand. And so historically, which I think was the same for say anyone in medicine or anyone thinking of wellness, the focus of wellness was a lot on an individual person and building resilience. Like that definitely exists. If you look up some of the ACEP, wellness either PDFs or any kind of the resources from years ago, you will find like a full wellness wheel, with all the spokes of, spiritual, physical, environmental, it's perfectly fine, but I think that when I was talking about all those like large external factors, like you can't use this wheel or my green juice to get over it. So what we're actually more focused on with the section and our committee is the systems issues. And there's actually like a counterpart or a follow-up to that document from the wellness wheel. We have essentially like a textbook, enormous amount of information to help emergency physicians focus on the system issues. We could certainly link it in the podcast as far as the resources, but let me explain what I mean by the system issues. So there's a couple of great models of well-being, and the National Academy of Medicine has like an extremely thorough, detail-oriented, a lot of facets of a well-being model. But I actually like the Stanford model of professional fulfillment a little more, and I think it probably would speak to emergency medicine physicians with lower attention spans better, because it's much more simple and the math is simple. So let's just like imagine a pie chart, and you're dividing it into equal thirds. That's like as far as my math skills go. So if you take one, like each of them, a third, a third, and a third. So 1/3 is dedicated to personal resilience, which is what, again, like most people think of wellness, yoga, meditation, mental health. Another 1/3 of it equally is devoted to the culture of wellness, which really refers to, the behaviors and norms, like how it feels in your department to, talk about wellness or talk about, things in general. But it also has to do with your interactions with your leadership, the sense of fairness, and, whether people want to spend time together, outside of work or they don't. And then finally, that last third refers to the efficiency of practice. And, that just has to do with your actual work. So you can imagine like an example would be like, how is your physical workspace designed to allow easy communication amongst the clinical team members? So in my pediatric ED, in my clinical workstation, my computer, it's actually set up in a way, which we love, is that it's actually facing the nurses. So they sit at their computers. They're not always standing up on the wows. And so we're literally facing each other. So I can go see a patient and very quickly say, hey, we're doing this today. He looks okay. I'm going to just do this. So it's very easy to have the communication, but I know it's not like that with my colleagues on the adult side. It can be a little more challenging. The clinicians sit in one area, the nurses are all over the department. So just taking the time to design your workspace, if you have an ability to alter that, could be an example of making your efficiency of practice better. That's what I mean.
Yeah, I love how you're focusing on the things that we can change about the workplace environment. It's not always easy, but I think there are ways that we can make our job a little less tedious and really enjoy the people around us. So I think that's really what you're talking about, and I really
And
love
like
that.
one more thing I want to make sure is very clear, if I've painted this beautiful pie picture for you, is the resilience, like the personal things that you can do on your own that like only you can control, is only a third. The other two, the culture and the efficiency of practice, those are system issues. That's 2/3. So there's actually a lot more that drives well-being, or the flip side, burnout. And it's 2/3 of it are the systems issues. Only a third is really like things that might be going on in your life. There could be illnesses, family members, that's obviously case by case or person dependent, but how things are, how your leadership interacts with you, good or bad, is the culture, and that affects everybody. So that's why we think you get more bang for your buck focusing on systems issues. And it's important, I think, that people know that that's kind of what we're trying to do, as opposed to, just trying to get together on Zooms and doing like Zoom yoga.
I'm imagining doing yoga with like the fire burning around me, and I
Yeah.
feel like that's a shift sometimes.
Oh my gosh.
So tell me a little bit about what your section is doing and what do you think the wellness section does best?
Well, again, we work hand in hand with our well-being committee, and if they didn't, do the hard work and promote the, create the content, I think I would have a lot less to talk about. But I think as a section leader, and what our section does, aside from promoting this, is that we serve as a network for our ACEP members, people to share what they're doing at their own institution, and be a sounding board for others for ideas. You just learn a lot about what people are doing and can kind of quickly take it up yourself just because you hear about it. It's not necessarily something published. We also have a strong passion for advocacy, because we feel like the only way to get those big, improvements and changes is at legislative level or just higher advocacy level. And so we partner with a lot of sections when we write our resolutions for the big board meeting at the end of the year. And I'll just highlight like two examples. So two past resolutions from 2024 were asking for support for the Well Workplace Policy Statement. I'll tell you about it in a minute, but essentially the Wellbeing Committee wrote up, well, they defined what is a well workplace? What should every emergency department be striving for perfection, which of course, nobody's there right now. But, they had to define it. They had to start somewhere. And so, we submitted as a resolution, like, please help us with our resources through ACEP to promote, advertise, and, help support best practices that were defined in this well workplace policy statement. And another outcome is that they want to incorporate these ideal, facets of your work environment and practice to be part of the ACEP's accreditation program that they're rolling out. I think another very important resolution that was passed was regarding workplace violence. It's like not acceptable to go to work and feel unsafe, or to feel, like you can't do your job well because it's too much on your mind. And so the resolution that we put place in partnership with New York ACEP last year was to ask ACEP to advocate for, emergency departments nationwide to preserve and protect the reporting of our workplace violence incidents, trying to maintain confidentiality and, not allowing for repercussion or recrimination, and really like work with the government agencies to try to monitor it and try to create national legislation to prevent violence and respond when they happen.
I appreciate your work on that. The workplace violence amendment is very near and dear to my heart, but I also love how you're kind of finding the ideal. So you're defining through ACEP what would be better. Sometimes I feel like when we're in the woods of it, it's really hard. It just stinks and you don't really know what would be better. So I really appreciate you defining that so that we have a goal
Can't say that
that
I
maybe it
defined
can be
it.
better.
It was our very important well-being committee, but I'm happy to promote the ideal state.
Well, I appreciate that. And I'm thankful for the work that they're doing too.
Yes.
Speaking of that, tell me about these reinvigorating emergency medicine webinars that you're doing.
So the well-being committee, as part of like some of the work subcommittees that they have, they wanted to create content, essentially for our members to benefit from topics regarding well-being. So they wanted to, you know, help people feel like a sense of hope. It's called reinvigorating emergency medicine. But we want to help take people that might feel either burnt out or, like nothing can change, and try to give them tools. And so there were a series of 4 webinars that were kind of led and given by our faculty essentially that are leaders and experts on these topics. So they wanted to explain, what is wellness at a system level, probably similar to some of the things I talked about today. Other topics, these were all recorded, so I believe we can access them. But so talking about systems level changes, overcoming compassion fatigue, managing second victim syndrome, what you kind of experience when you witness everything in the ED, and healing through narrative medicine. So, this was sort of decided from the Wellbeing Committee, like what would benefit most emergency physicians. And so this is trying to reinvigorate them and make them feel like they have tools, they have a sense of hope.
Excellent.
Yeah.
So it sounds like you're trying to define the ideal workplace and then get that out. Are there any events where the wellness committee or the wellness section is trying to tell us how we can do these things?
Well, I think about like sort of like the content of like what our section is doing, but a lot of it crosses with the committee. So we are always tasked with the programming for ACEP Wellness Week, and I don't know that everybody knows that this exists. We're actually pushing it from a May or springtime sort of celebration to I think something more so in the fall. So this year is going to be a little different than other years, but in the past you may have seen either on the Instagram or if you happen to be on the engaged and you were following the wellness section in general, every day we kind of defined like what's a thing that we should do in the name of say wellness. And really like our hope was just to get conversations, get people to, talk. I don't think that we were like expecting you to like snap your fingers and in 1 week out of the year you're going to be well, but everybody needs a turn, everybody needs time. That was sort of our time allotted. And we're thinking that it might be better suited to start in the early fall to kind of like define, hey, here are some practices, here are some things that we can sort of do to support our well-being early on when you're still like, especially like the new trainees that are starting, like it's summer, you're still fresh. I think in the spring, you kind of say to yourself, I could have used this info like a year ago. And so that's why we want to adjust it, kind of to our members' needs. But the idea is to, you know, set aside time to make it important for a week. I'll start with that, but I would be very happy if it was, say, celebrated or taken up more than a week out of the year. That's something that we do with the wellness section. Um, there is other opportunities for kind of participating in say well-being content and some educational things like a peer-to-peer emergency physician training course. So this was also created by the Wellbeing Committee, but essentially the idea is to take, motivated emergency physicians that want to start a peer support program in their own department. And so the course is designed to train the trainer. So you could take this immersive course and feel equipped to start it at your own institution. And it certainly is tailored for many practice environments because, as we know, everybody doesn't just practice at a high level academic or tertiary care site. And, we want to be able to give people tools to support, your colleagues and thereby supporting yourself. And, hoping that you could kind of intervene before it's too late. Our next training, we're looking to schedule something a little new, like a virtual offering as opposed to in person, something in the spring. But there are plans already to have in-person training at the annual meeting in Salt Lake City. I believe the Accelerate meeting in January, like these two big meetings every year, there will more or less always be the course offered then. So, be sure to mark your calendars. And another way that the wellness section in partnering with the committee, has been working to try to, I don't know, create opportunities for our emergency physicians to work on well-being. So we want to, take the power of the Lorna Breen Act. I think everybody in ACEP and in emergency medicine knows about Lorna Breen and what happened, but the fact that Congress, bipartisan passing of legislature to, promote healthcare worker well-being, it's so helpful to have those permissions. What we're trying, and I also think it's important for people to know in a granular level how it can help them, because it sounds good or it sounds tragic that an emergency medicine physician took her life, but we're getting something that's helpful to us, but you may not know how. So what the legislation is trying to do is to remove intrusive mental health questions in, state licensing applications or the hospital credentialing applications, essentially asking you if you've ever had problems with mental health, seeking treatment. We don't want them to ask these questions and then you feel either one of two things. You feel a fear of disclosing it, or you feel like you won't even seek out the help because of the fear of having to disclose it, essentially not trying to help yourself. And so we're partnered with SAEM to, participate in a Stop the Stigma campaign and encourage our own members in ACEP to work on removing these intrusive questions about the mental health with the applications. And I could provide this link, but there's like a direct link through the Lorna Breen Foundation where they really assist you locally in your own hospital, your own institution. If you can get your hands on the credentialing paperwork, if you can examine it, look for that language, frankly, you could just get it as long as you have permissions, and you can submit it to the foundation. And they have lawyers, they have people who are experts that can look at the language and sort of say offer tips to help the hospital adjusted. And we're hoping as emergency medicine physicians, Lorna Breen was an emergency medicine physician, like we want to be the pioneers. We want to make things better for all. And I think that we're trying to kind of like almost create like a little competition. How many states can we get this passed? How many like local departments can we make the change? And I believe there will be like a recognition for all of these people, these ACEP members that can get it done at the national meetings. So if that is like exciting to you to get your name, somewhere visible, that could be a challenge for you. But this is a way that you can actually make a difference, not only for yourself, but also for your colleagues and maybe even some of the colleagues you consult. Um, and then one last thing I guess I wanted to say as far as like some of the work that we do in the section. And can you tell that we're not doing yoga during these meetings? We don't have any time to
Oh,
do.
sorry, I was about to go do some yoga.
Yeah. I like I just want to take a step back because I want to share a story from one of my friends from my Penn fellowship. So when once we graduated and she knew that I was really interested in, say pursuing well-being in an academic way, we talked about how she really didn't like yoga and meditation, but I do. Like, so, I do, and I do think it's a tool for me, but I know that's not it. But she told me, I don't like yoga or meditation. And she said, I don't really care that my hospital like sends us, to see a nice Broadway show, for free, like an outing. It's sort of encouraged. She just said, I just wanted the things, that help me do my job well to be addressed. Like that's what really got to me. And at the time, we're kind of fresh out of fellowship and we're young physicians. Um, it was a bit of a dagger in my heart because I felt like what I stood for, what I wanted to do with my life and my passion, like in this space, just would never please her. And so it took a few years to ruminate on that. So a few years later, that conversation shaped me to develop this Pebbles in the Shoe project. Now, I didn't coin the term Pebbles in the Shoe. I think most people know what a pebble in the shoe is or what it means. It's like a small thing, a small frustration, but it can really, really irritate you, really get on your nerves. It might even be like a straw that breaks the camel's back. And if you want to, you could read like a news article that I wrote for our site for the wellness section. You could certainly reference it, but to just explain what the project is. So what we did was we really operationalized the concept of fixing pebbles in the shoe. I mean, you can imagine just fix the problem, done. So we really tried to operationalize it so that it would be a little more methodical and reproducible, within our own department, but certainly in other emergency departments or even any department of medicine. The whole point of the project was to address workplace frustrations that are relatively small, but when you do them in succession, they can amount to really meaningful positive change. So let me give you an example. So of fixing like a pebble. So we had, you know, discussed in my department, like how challenging it is to have a corded otoscope. So this otoscope you have to plug into the wall. You have to find, a physical place with the cord and like relative to the patient that you're seeing, say in the waiting room. It was really cumbersome. It was really like making it unpleasant to go see a patient that probably could be seen quite easily, even though you're walking all the way to the waiting room. And we talked about well, why don't we just get like a cordless, chargeable otoscope? So it just makes that whole process much easier. And it's very beneficial, obviously, seeing them faster, all these things. And so working on this Pebbles project, what really I think makes it successful and made it so popular in my department was because it really feels like the most control that I have as a clinician, to directly impact my workplace experience and like shape it to be better. And we're lucky. We have really supportive leadership. They're willing to hear it. They're willing to do what it takes to make it happen. There's always limits, but when we speak about these things, they try to like fulfill them. They try to fix the pebbles. And we had an opportunity to present this work from my institution at the national meeting last year. There's some links in like the Annals of Emergency Medicine of the abstract, and we presented it as a didactic. So if anyone is really interested in this concept or starting the project and the program in your own department, please feel free to reach out to me. I make like house calls, like I'll set up a Zoom and speak to you, sort of share my slides and show you like step by step how to do it. And certainly, I can help. So if my story resonates with you, if this to you could improve your wellness, then this section is for you.
So it really sounds like you're really trying to move from just the yoga to the advocating for all the little things and the big things, removing the stigma, making it easier to access mental health care, and then finding those little frustrations that really make a big difference if you can't overcome them.
Yeah, the low-lying fruit, it's right there, ready to go. So we try to address it all at different levels.
That's wonderful. So sounds like you and the wellness section are great, doing great work. We're advocating for these things. Tell me a little bit more about what you advocate for.
Well, I hate to be a broken record, but like I said, the systems-based efforts are really the answer. And like I mentioned before, like the reason is because they'll reach more people, offer the most benefit. It's the way of the future if you want longevity in your career in emergency medicine. And isn't that really what we all want? We want to like go to work, feel good, keep going back, not dread it, have long careers, large retirement funds, and just want to feel good about the work that we're doing. I'm talking about the Pebbles in the Shoe project, but sometimes it does require high level advocacy with legislature and working with your hospital leadership, like the Lorna Breen sort of act and that higher level, fixing the credentialing paperwork and applications. But I would say, that's not for everybody. Not everybody like wants to do that kind of stuff, and I don't blame them. So I think the best and easiest thing to do is to work closely in your own emergency department with your local leadership to try to influence the culture and partner with your leadership. And so I referenced it, but I think that when you have like an ACEP stamped document that defines like this is what is going to promote well-being, this is what is going to, this is the standard that we should be striving for. I think when you have a document like that in your hand to go to your leadership, has a lot of weight behind it. It isn't just like a single person complaining. This is what, a large organization is stating, you should have all this. Now, I definitely acknowledge like in any given emergency department, you're not going to have all 20 facets perfectly done right now. You have to start somewhere. And so, if you feel like you have a lot going on in your department for well-being and you want to take it to the next level, that policy statement, has a lot of like, say, the content or the ideas, what to do, and you could use that. Plus, I should also mention there's a like an excellence in well-being, like workplace well-being for different departments or training programs. So if you really want to do this at a high level, there's an ability to like compete and submit your program for recognition for an award from the wellness section at the end of the year. I could give it to you. But if you feel like you're in an emergency department right now and you feel like there's really nothing in place, you feel like you're starting from scratch. Um, I mentioned it before. We have this more updated self-to system ebook, essentially almost like a textbook, which has like very, very comprehensive. This wouldn't be like a one night read. You'd probably have to take some time with this. Just to start somewhere to address all the things in the well workplace policy. If you feel like it's a little too vague as far as the operationalizing of the policy statement, just know that there's also a self-to-system book that can help you get you there. Plus, like I mentioned, human beings at wellness section meetings that could also help you.
That's excellent. So as you may know, the Young Physicians section and ACEP in general has this new attending bundle where you get a whole lot of resources for free, and one of those are free section memberships for the first 3 years.
Yes.
So what would you say to the young physicians who might be interested or looking to join your section?
Well, I would say, we're like a fun group, generally speaking. It's like on the more fun light side. We provide a lot of tools that help individual physicians advocate for themselves in their own departments. Like I mentioned, we know that like some departments will have it and some might not, but don't you think it would be really helpful to kind of like bring this to your boss or your leader and say like, hey, we have a very clear picture for what we're striving for. And like, wouldn't you like that to be in place when you're starting off in your early career? Um, so I would say that would be a reason to join the wellness section as a young physician, or like in the early state. And if you really just want to feel empowered in your work experience rather than passive, feeling like a victim, things are happening to you, if you want to talk to like-minded folks, the section I think would be good for you. And then lastly, if you're not a young physician anymore, but if you're a leader, if you think you want to be a leader, or program director for a training program, and you want ideas what to do with your program, like if you want to start this as a young physician, this would kind of give you the building blocks to get there. Because the whole point is to keep emergency physicians doing what they're doing and loving what they're doing.
That's excellent. And the sooner you get it done in your workplace, if you get there and you decide it's not all that it's cracked up to be, you can change it. And it sounds like the wellness section is giving you some resources along with the well-being committee
Definitely.
to help you and to find that goal. So excellent. Thank you so much. I'm really disappointed though that you didn't mention margaritas on a beach because I think that every wellness section needs to have that.
Oh, I mean, at the national meeting, there will always be the section hall crawl. You're gonna see all the sections. You'll see us. And last year we gave out liquid IV packets to kind of like help offset the Las Vegas debauchery. But I think this year we're planning to have like an off campus or like off site sort of get together because since a lot of the work that we do is virtual, like all the meetings are virtual, and then like the meeting at the national conference is, so formal. We wanted to have an opportunity to like spend time just as ourselves together. We are planning to just set something like that up. So, some carrot to dangle in front of you to look forward to at the end of the year.
Excellent. And the wellness section does put out a quarterly newsletter with concentration on those topics of choice. So if you
Yes.
join, you'll also get that. You'll get the community, you'll get the chance to network, talk about great ideas, and maybe get some of those pebbles into sand and make sure that they're not boulders. So
Exactly.
thank you very much, Diana, for being here with me. I hope everybody's enjoyed this and hopefully we'll get some things going. Thank you so
Right.
much.
Thanks for the time.